Welcome to the AARDY.compare.com YouTube channel for travel tips. I'm Jonathan Breeze, the CEO, and today's topic, Airline DVT. Now, so the CDC has some excellent advice concerning airline DVT and PE, so please take it seriously and do what you can to avoid these potentially fatal conditions. We do want you to think a little more at a tangent though. Instead of suffering on long-haul flights in an economy seat, why not consider paying to sit in business class? Now, more legroom, lie-flat seats, dedicated bathrooms, more space to stretch your legs and to walk around. Now, we understand that this is easier said than done, but it is possible to book in business class at a significantly lower price point than you might imagine. By booking a long time in advance, ideally 11 months in advance, you get a better price seat. And then book a non-refundable ticket, the cheapest possible ticket. Finally, take travel insurance for the flight that includes cancel for any reason coverage. You now have the lowest price business class seat with insurance that turns it into a flexible or fully refundable seat. Now let's look at DVT and PE in more detail. So some long distance travellers are at risk from deep vein thrombosis, DVT, and pulmonary embolism, PE. So DVT occurs when a blood clot forms in a large vein. Part of a clot may break off and travel to the lungs, causing a PE which can be fatal. Almost anyone can have a DVT. People travelling for extended periods of time may be at increased risk from DVT because they have limited movement. The increased risk is usually associated with air travel, but DVT can also form during travel by bus, train or car. Now, most people who develop travel-associated DVT have additional risk factors, including a previous blood clot, family history of blood clots, known clotting disorders, recent surgery or injury, use of estrogen-containing birth control or hormone replacement therapy, older age, obesity, an active cancer or undergoing chemotherapy, and limited mobility. So you can take steps to help prevent DVT. So for long distance travellers, these steps include getting up occasionally and walking around, exercising your calf muscles and stretching your legs whilst you're sitting, and selecting an aisle seat when at all possible. So for long distance travellers with additional risk factors from DVT, talk to your doctor about taking extra precautions such as wearing properly fitted medical compression stockings, taking medication before departure to prevent DVT. It is helpful to know the signs and symptoms in the event that you develop DVT or PE. If you have symptoms of DVT, call a doctor right away. If you have symptoms of PE, you should seek immediate medical care from a doctor or the emergency department. Early detection and treatment can prevent death or complications. Now, DVT symptoms include swelling, pain or tenderness in the affected limb, usually the legs, redness and increased warmth of the skin in the affected limb. PE symptoms are unexplained shortness of breath, faster than normal heartbeat, chest pain, a cough which may be bloody, and lightheadedness or fainting. Now, it is not possible to diagnose either condition without special tests that can be performed only by a doctor, such as an ultrasound, a CT scan, or an MRI. That is why it is important for you to seek medical care if you experience any of these symptoms of DVT or PE. Safe travels.